Hello there, and welcome to Politics 101 on Outside Views. The differences between the German healthcare system where I'm living and the British one could not be greater. While in Germany you have the choice between a private and statutory health insurance, Great Britain uses a uniform system. This means there is no classic health insurance in England. Instead, the state ensures that every citizen has access to medical care and assumes a large part of the costs for it. However, the British have to pay for some services themselves, such as medicines, visual aids, or dentures. Nevertheless, there's one big thing in common. Britons have the option of taking out private supplementary insurance or full private insurance to protect themselves against high costs. The first point of contact for health problems is the local family doctor. However, the choice of general practitioners is often restricted and is influenced by place of residence and entry in a special register. Only those with supplementary insurance are really free to choose. Anyone who is referred to a specialist by their family doctor does not go to a practice as here in Germany, but to a clinic. Since it can take a long time to get an appointment with a hospital doctor, private insurance also has advantages for patients here. Otto von Bismarck was the father of social health insurance here in Germany and gave his name to it. It's Otto Nova. He founded the German health insurance system, which is financed from the social security contributions of the insured and enables all citizens to receive basic care. The British health system dates back to a 1940 report by British MP William Beveridge. In it, based on the idea of a welfare state, he proposed giving every citizen access to medical care regardless of their personal circumstances. This system should be financed by taxes. On his recommendation, the National Health Service England was formed a few years later. In principle, the system is similar to the citizens' insurance that is much discussed here in Germany, but I'm not for it, obviously. The National Health Service England embodies the British health system to this day and is the employer for a large part of the medical staff. Reporting to the government, it is divided into 4 separate institutions for England, Scotland, Wales, and Northern Ireland. The NHS organizes all medical care and its funding. The regional organizations decide, among other things, how the services in their region can be best supported and insured. Since it was founded in 1948, there have been repeated reforms and restructurings. In addition to the NHS, there's also the national insurance in England's social system, which, among other things, secures pensions in old age. In the UK, every citizen has a social security number, which is used to register social security contributions to distribute unemployment or old age benefits accordingly. The employer also participates in the state provision for old age. The German healthcare system is financed according to the principle of solidarity. Employers and employees pay into a large pot that finances the health insurance, and the basis for the contribution is the level of income. Medical advances are primarily financed by private health insurance, where contributions are based on the personal risk of the insured and not the income. The welfare system in England is organized somewhat differently. As mentioned before, the healthcare system is not funded by social security contributions, but by taxes. The British therefore pay no direct contribution to health insurance. Instead, the state finances the health system, which is therefore closely linked to the state budget and the government's financial policy. For this reason, there have been repeated losses in the quality of treatment in recent years. The British health system offers citizens medical care that is virtually free of charge, regardless of their personal circumstances. Health spending in Great Britain is regulated by the state and lower than, for example, here in Germany. However, the austerity course regularly takes revenge, for example, when the flu breaks out. The corona pandemic in particular has clearly shown how different the healthcare systems in Britain and in Germany are. While the German system has received a lot of praise from abroad, experts warned of a possible collapse of the British health system at the beginning of the pandemic, and as we see right now, they were not that wrong. In principle, state-funded care sounds advantageous, and in fact people in the UK are proud of their own healthcare system. But the almost free healthcare is always reaching its limits at certain points. The more doctors there are in a country, the better the care works. While the doctor density in Germany is 4.3 doctors per 1,000 inhabitants, in Great Britain only 2.9 doctors are responsible for the care of the same number, 1,000 inhabitants. In British hospitals, there are only 6.6 beds per 100,000 inhabitants. In Germany, there are 29.2 beds. The UK healthcare system is short of money, which is affecting the quality of care. With a shortage of intensive care beds and staff, many Britons are waiting longer for surgeries than other Europeans. In the case of non-essential treatments or surgeries in particular, Great Britain brings up the rear in terms of waiting times. The free NHS has suffered from harsh austerity measures, as I said, for more than a decade, and recently there have been several strikes by healthcare workers, including nursing staff and emergency services. They wanted to increase pressure on the government to raise wages and, maybe more importantly, improve working conditions. The Conservative government is refusing wage increases despite record inflation of more than 10% still. The British government blames the consequences of the corona pandemic and the flu wave for the current situation and assures that it wants to do more for hospitals. In his New Year's greetings, Prime Minister Rishi Sunak named the NHS as one of his priorities. But all experts say that it has nothing to do with short-term things, that it is a long-term problem, and the flu is not causing long-term problems. And so they contradict the government. And I'll see you in my next video. I'll be back.